Good afternoon. Thank you again for coming and for watching this video. I'm Dr. Barnabas. I am a childhood cancer specialist. I'm called a pediatric oncologist. I treat children with cancer at Mbarara Regional Referral Hospital, and I teach doctors of Mbarara University of Science and Technology. And I lead the cancer program at Mbarara Regional Referral Hospital. And I'm glad to once again continue with our talks about childhood cancer. Last time we talked about what cancer is and how it comes about, what causes it. Now we are going to talk now about what causes cancer. What causes cancer in children is really largely unknown. Because children don't have clear-cut risk factors for cancer. So any child anywhere at any time can actually get cancer. So we really don't talk so much about the cause of cancer in children. It just happens in most children without any warning sign. And that's how it's different usually from cancer in adults, which may have sometimes clear-cut causes. The commonest cancers in children include cancer of the blood called leukemia, also cancer of the kidney called Wilms tumor, and also cancer of the lymph nodes, or what they call enterogunyu or nsanjamavu, called lymphoma. So that's the commonest cancers, the three commonest cancers in children, and they occur at any age. Any child, any age can really get cancer. There are cancers which are common in very young children, below 1 year. There are those which are common in the middle there, and there are those which are common in adolescents and big children. So any child anywhere will get cancer. There is nothing like cancer is common in one age group. There are cancers that are common in one and cancers that are common in the other. How you can recognize that your child has cancer is, as we said last time, is if a child has a swelling or a mass or a lump on the body. If a child has a lump on the body, that could be cancer. And every child with a lump on the body needs to be tested for cancer. And also the other thing that may point at cancer in children is if a child requires blood transfusion several times. So those two really, requirement for blood transfusion several times, 1, and 2, the child getting cancer. When that happens, if you're here in Western Uganda, bring that child to the cancer ward of children of children at Mbarara Regional Referral Hospital. All you need to do is come to Mbarara Regional Referral Hospital, reach at the gate, and ask for the ward of the children with cancer any day. When you reach here, we shall assess your child and see whether the child has cancer, and we shall tell you. When the child doesn't have cancer, we shall tell you. And when we think the child has cancer, we shall assess them to prove that either they have cancer or not. Cancer is like any other disease. Some cancers are easy to treat, others are not very easy to treat. Some cure so easily, others actually are difficult to cure. Some may not actually be curable, but some are curable. But the beauty with childhood cancer is that most of it is really, really curable. The majority of the children's cancers are actually curable, and indeed they should cure. And one of the reasons as why cancer in children may not cure is because they present late. When they present, when the disease has already grown so much, it becomes extremely difficult to cure. But also when they don't complete their treatment. Some people, when we start their treatment, after a short time, they give up on the treatment, and then they go and then they come back later. So those two are the commonest causes of treatment failure in children. 1, coming late for treatment when the disease has grown, and 2, failing to finish and complete treatment. So those are very, very important things. But cancer is like any other disease, even malaria itself. Sometimes you can treat it and it cures immediately, but actually some people don't cure. So some cancers, even when they are curable, or they are possible to cure them. Some children just don't cure. And cancer has this unfortunate part, so sometimes it goes away and then it comes back. It's a very, very painful experience and very painful thing when a child, you've treated him, the cancer goes away and then it comes back after some time. Usually there's something else we can do for them, but some children, when it comes back, it's no longer curable. Yeah, about herbalists and other people who say they can cure cancer, I would just like to ask you to be careful about them, because cancer is not a very simple disease to treat. If cancer was a simple disease to treat, to be honest with you, no one will be dying of cancer. So be careful, honestly speaking. I have totally no knowledge and understanding of the work of herbal medicine or traditional healers. But what I know is that there is really no other cure for cancer apart from the drugs that we give. And so if a child has, when you suspect the child has cancer, please bring them to us. We have trained in treating cancer, but many children actually are taken from here. When you tell them they have cancer, they are taken from here to traditional healers, but they don't cure, to be honest with you. So I'm asking, please don't walk around looking at herbalists to cure cancer. Cancer is not a simple disease to treat. No, we should first thank God and thank the government for establishing this cancer unit here in Mbarara. There are only 2 cancer treatment centers in Uganda, here in Mbarara and then in Kampala. So we should just be thankful first. And this clinic was actually started by doctors themselves. They're the ones who actually started it, even before the government came in to support us. And so we just want to thank them, those doctors who were kind enough to start this cancer treatment center. So hopefully there will be more cancer treatment centers. They are rolling out a cancer treatment center in Gulu. They are planning to start one in Arua. They are planning to start one in other places. And as more and more people get cancer and more people demand for services, I'm sure we shall have more and more cancer centers. But of course, the important thing is to have specialists who can actually treat cancer. Thank you very much. That's all for what we have today. And hopefully next time we shall talk about other things regarding cancer. Keep looking for these videos and keep watching the News TV. And thank you so much.